This podcast is for educational and informational purposes only. It should not be used to substitute the advice from your medical professional or primary care provider. If you are having any kind of medical issue or emergency, you should call 911 or go to your nearest emergency room, urgent care center, or consult with your doctor.
Welcome to Healthcare Snitches.
Welcome to episode 2 of
Healthcare Snitches.
All right, guys. So this episode is geared towards how to advocate for yourself as well as advocating for your family members or friends in different healthcare settings. So we just want to have more like a conversation this episode since it's is this episode 1 or 2?
This is episode 1.
Oh, episode 1. And we just wanted to have more so of a conversation because one thing that we've realized in our personal lives as well as our professional lives is that a lot of people go to doctor's appointments and they just don't know the questions to ask. They don't know how to advocate for themselves and their health conditions, even if it's just like a regular physical exam, but more so if they have to go to like a specialist, if they have cancer, something like that. And then also, we've also noticed that with our family members, or even with ourselves too, if we go to the ER, sometimes we're just treated poorly, like we're forgotten about. And so even though you're in the ER because obviously you're sick, there are some ways to advocate for yourself. And if you're like accompanying a family member, there are ways to advocate for them as well so that they can get the best care that they need, either in the emergency room or if they're in the hospital for surgery or some other type of condition.
So what I've noticed, even when my mom was sick, she was pretty much out of mind, out of sight. She felt like if the doctor didn't tell her anything, then she was all good to go. But there are some times that you get tests done and you don't get a phone call about your results. And if you are elderly, there are times when you don't know how to check a patient portal for your results. So there are times when there are stat results and you hear nothing.
Well, that is poor patient. Yes, that is poor patient care. Honestly,
it is.
And that also, in our episodes, we'll have one on how to choose a specialist, how to choose a primary care provider, and I feel like that is one of the things that goes into making the right decision about who performs your care. So obviously receiving test results is one of those things.
It's major.
And
also, you should never settle for a doctor just because they are within your network. For me personally, I always do extensive research, which Jasmine knows about because she has taken my word on some of my doctors that she also goes to. But I do extensive research. I read reviews. It's very important to find the right doctor. There are too many doctors out here for you not to be happy with one or for you to just deal with one who really doesn't care about you. You never just want to be a medical record number.
Yeah, so I think of healthcare as any other piece of business, right? So going to a restaurant, going to a store, going to get your hair done, like
a resort, a flight.
Right. We are consumers of healthcare. And I feel that, if you're not getting what you need from who you're going to, do not be afraid to go elsewhere, right? And also word of mouth is the most popular way that people choose people like doctors because they take their good friends' word for it. Because if the care is good enough for them, it's going to be good enough for me.
Yep.
So you do want to just make sure that doctor is the right doctor for you. And a lot of the other things will kind of fall into place. So one of the things we were talking about before we started recording this is that I trusted Kim on a recommendation for a PCP because I've been looking for a new one.
And a dentist.
And
an oral surgeon.
And an oral surgeon who's connected to the dentist.
Yeah.
But the PCP that she recommended, we talked about ways that you can prepare yourself for your annual physicals with your doctor and how you can advocate for yourself there. But the fact of the matter is that with our PCP, he makes it very, very easy for you not to have to activate all of your Google medical degree knowledge within the visit, because he's just that good. He makes you feel comfortable.
So easy to talk to.
Let's just say you did come in there with a notepad and a paper and you had a list of questions. He's not going to rush you. He's going to make sure he answers all of your questions. He is going to put his clinical knowledge behind the answers that he gives you.
Can I piggyback?
And you're not going to feel like you are dumb for asking the question.
No, never. But also, me personally, I'm a hypochondriac. So by the time I go to the doctor, I already know what I have because I've already diagnosed myself. Mm-hmm. So I'm just going for a second opinion and possibly a prescription. He never makes me feel like I'm crazy. He is so easy to talk to, as Jasmine said. You need to find a doctor that you just feel very comfortable with and that you trust. If there's no trust there, it's not going to work.
It's not. So we wanted to make sure we covered a few points throughout this episode so that you guys feel like you are at least a little bit armed with what you would need to advocate in different settings. Yeah. And some stories that we've heard or experienced personally that we could kind of like share with you guys. So one of the first things is how to advocate for yourself during a regular office visit. I know Kim has some pointers on that.
Sorry, guys. I was drinking out of my healthcare Snitches mug. Isn't that cute? Mm-hmm. Mm-hmm. Okay. So, yes. So you should always be able to speak with your doctor about anything that is bothering you or any questions that you have. Once you can advocate for yourself, I just feel like your care plan will be better understood by both you and by your doctor, your specialist, your PCP, whoever it may be. Always ask questions. Never ever feel like, oh, this is a dumb question. This is a stupid question. Because even though you feel like that, it's really not. So always ask questions. And then also, if there is a doctor who is refusing any type of test or scans or anything, please have them document in the chart that this was not necessary. So let's say that you're in the shower, you feel a lump in your breast. Oh my God, I'm only 29, but I'm afraid. You go to the doctor. Tell your PCP or your GYN, whoever, and they tell you, oh, you're only 29. You do not need an ultrasound or a mammogram. No scans of the breast because you're only 29. Mm-hmm. Age is nothing but a number, but you can get sick and die at any age. Understand that. Okay. Have them document in that chart that you do not need this because it's only a cyst or it is only fatty tissue, whatever it is that they are saying. I can bet my life on it. And Jasmine, I don't know if you'll piggyback. Mm-hmm. They will do the test because we don't know what it is until we actually get the scans. So you have to advocate for yourself. That is an example of advocating.
Also, just to piggyback off of that, right? Your medical record and your progress notes are legally binding. And so by asking them to document that in that particular progress note, they will be bound to saying that they refused to do XYZ, right? So we're not saying you found this holistic treatment in, I don't know, Mexico or Cuba or Costa Rica or whatever, and you're like, I want this right now, and they're refusing. No, we're talking about you have a genuine concern, you've done your research, or just that you have a genuine concern about your body because you know yourself best, and you want them to do further testing, and that they are refusing to do that. I guarantee, based on their not only their medical knowledge, but also the liability that it would put them in or have them in, they're gonna do the test because they don't want to have to document that they refuse to do something, and then months later or weeks later come to find out you actually do have cancer.
You're at stage 4.
you're at stage 4, whereas, if they did that test weeks ago, they would have caught it. And now here they are, you're suing them because of negligence, right? Because that's negligence. And so forcing them to put that in writing, to hold their feet to the fire, to say, I refuse this patient their right to care, they're not going to do that. They'd rather do the test, whatever it may be, and that will make you feel a lot better too. And also it could be something. It will cause them to to do the test pretty much, because they don't want to document that, or explore alternative treatment.
Yes,
or
definitely.
Diagnostic options,
because it could be something that is a little suspicious, and they may want to go on and do a biopsy next. But now, if you do all of this and the doctor is anal and they're adamant about this is nothing and I will document it, that's fine. Understand, there are other doctors within your network who will accept your insurance that you can go to. So do not take one doctor's no as the final answer. Always trust your gut instinct. Always. Because I feel like our gut instincts are pretty valuable.
Yes. Another thing that comes to mind when I think about advocating for yourself is being on the other end of this, right? So working in healthcare, working with a lot of doctors, you being a nurse on the floor, there are patients that come in and they're like, well, I looked on WebMD and I'm going to die if you don't do this. And they have gotten their medical degree from the internet, and they come into their appointments and they come in with all these things, and they've already diagnosed themselves before.
I've been there.
Before they get in there. And the doctor is just looking at them like, well, I went to medical school for, I did 12, 15 years of training. How dare you come in here after you Googled a few things and tell me what you have, right? And so there's a way to kind of go about going into your appointments where you're presenting it where you're not offensive, but also just knowing your body. In terms of doing your own research, you do want to do it, but you don't want to overdo it, because sometimes we can get into our own heads where we've already, we have a bump on our arm, or we've diagnosed ourselves with melanoma, but you don't know until you know. Really, that is it.
When I was in nursing school, this sounds crazy, every single topic that I learned, I had every single symptom. And even when I got up to prostate cancer, I had prostate cancer, guys. Even though I don't have a prostate. I don't have a prostate.
I can't.
But I've had prostate cancer.
Mm-hmm.
I've had cervical cancer. I've had uterine cancer because I was on birth control and I was spotting. That's just cancer.
Right.
A headache for too long, we got brain cancer.
Yeah.
You want to go in there knowing a little something, but you don't want to, as Jasmine said, go in there crazy.
Yeah.
And giving yourself a certain time limit as to when you're going to pass away,
right,
based off of something that you don't know if you have. And from personal experience, and I'm sure you too, you can make yourself sick diagnosing yourself.
Yeah, you can.
You can make yourself sick knowing in your head that it's cancer when it's really not. So you do want to make these appointments. And another thing that comes to mind, this is not really about advocating, but I feel like a lot of people in all nationalities and all types of populations, we know something is wrong with our bodies and we are afraid of what it could be. Mm-hmm. So we put it behind us and act like we don't know that it's going on. We actually have a friend who did that.
Yeah.
And she passed away from breast cancer. In 11 months, she died?
Yeah.
11 months.
You would know better than me.
33 years old.
Mm-hmm.
She was diagnosed at 32. Why? Because she knew something was wrong. She knew something was protruding from the inside of her breast to the outside of her breast. And she was afraid. She went when she just couldn't take it anymore. We don't want to do that, guys. If you know something's wrong, go to the doctor.
Yeah.
Advocate for yourself once you get there. Do not take no for an answer if you know that something is not right.
Yeah.
And everybody's case is not the same.
Everybody's case is not the same because everybody is different.
Yep.
Everybody's body is different. We react differently to to medicines,
Yeah.
to treatments.
But I know some ignorant people in my life right now. You know them too.
Mm-hmm.
They will easily say, "Oh, well, Myrtle had something like this and hers was fine." That's Myrtle.
Mm-hmm.
That's Myrtle's issue.
Right.
It may not be the same.
Yeah, it's all different. So advocating for yourself, um, at your PCP visits, at your specialist visits, especially, will have more like tools to help you guys do that, because we know we get the questions from our family members. Okay, I'm going to see the endocrinologist
Mm-hmm.
or the oncologist. What questions should I ask? And we'll sit with them and we go through the questions that they should ask them. And so there's just been so many, and this is why we've started this podcast, really, to get the information out there. So hopefully, everyone will be able to learn what questions to ask. And then with our checklist that we'll be having on Etsy, you'll be able to see for specialists what kind of questions you should ask, for pre-op.
We'll have information about HIPAA, about healthcare proxies, living wills.
Yeah, all of those things.
We will have all of
these are the
things.
questions that we get asked by friends and family. And it really helps set them up to feel at ease when they go for these appointments. And also, even if they've been diagnosed with something, they feel better about it because they feel more prepared to go into whatever they're facing. They feel knowledgeable. The doctor really pays attention to that when they ask those questions. They're like, oh, okay, you're not just some person I can just get over on. You're asking all these questions. All right, let me step my game up a little bit, because you actually know something. So that puts them on alert as well to perform better, to do their job better.
Right. I'm not boo-boo-the-fool.
Right.
So you can't just tell me anything.
Right.
My cousin, actually, multiple times on multiple occasions, she's been asked, "Are you in the medical field?" Because I have set her up with the right questions to ask. And she's like, "No, but my cousin is."
Mm-hmm.
And also during COVID, I don't know if you remember, one of my family members were actually diagnosed with cancer. And because of COVID, I could not go with him to his appointment. But I was on FaceTime and I was able to ask all of those questions because he just didn't know. And also, for anybody out there listening, if you or if anybody that you care about are diagnosed with cancer or with anything else, always have a book and a pen with you to write down these questions before you go, and then answer these questions. Write down the answers, because a lot of times you are stressed, you are afraid, you don't remember. Mm-hmm. And I always tell my friends and my family, write these questions out. Write the answers down when you get in there so you can look back at it later. And try not to go alone if it's something that is like terminal or something that is really scary, because you're just blanked out. Mm-hmm. You should always have someone with you, or a book in a pen.
Some form of support.
Yeah.
Right. And, the goal for us is to be able to be that support for people in the future at some point, whether that's in person or via FaceTime.
Telehealth,
right?
Something.
For people that don't have a support system, not everyone has a spouse or a cousin or a friend or anyone that can help them, and they really need that support. So having someone at least virtually through FaceTime, I think, is something that we want to be able to provide at some point. So hopefully, we can do that. Another thing we wanted to make sure we talked about was advocating in different settings. So this could be a whole episode within itself, but I know that I have experienced it going to the ER. So let's just start with going to the ER.
That's
right?
A whole zoo by itself.
A whole zoo. Deciding which ER to go to, if you have the options, right?
Some places don't.
If you are not having being rushed to in an ambulance to whatever ER is closest. If you have an emergent situation, deciding where to go, right? So you get there, obviously you're in an emergent situation, and so that's why you're there. And while you're there can be things that happen just in the waiting room itself, right? So it actually starts from the waiting room. So how do you advocate for yourself once you get in? A lot of people don't know, but once you get into the ER waiting room and you present yourself, you tell them what your symptoms are. A lot of times not a lot of times, any good ER will be triaging, which means they're prioritizing based off of your symptoms. So those that are presenting with more emergent symptoms like chest pain, right? They are going to be gunshots. They're going to be prioritized. And so if you're coming in and you have like you think your appendix has well, that might be prioritized.
If you come in and you've had a headache for a week,
right? But let's just say somebody else came in because they just got shot. Like, they're going to go in before you. And that's just how it has to work, because they have to work based off of what is more emergent.
Yeah.
And so you have to understand that when even choosing to go to the ER and how you get there, right? Because also how you get there depends on how you're triaged as well.
Whether you walked in,
right?
Or are you in the ambulance bay?
Exactly. Did you walk in? Did someone drive you there and just drop you off and you rolled out the car? Or did you call an ambulance?
Yeah.
There's a difference.
Or were you brought in by the police?
Right. Handcuffed with an escort.
Right.
All those things make a difference in how you're prioritized once you get to the ER. But once you actually get back into like a room or a bay or a hallway, it's so sad. But unfortunately, everyone thinks their issue is an emergency.
Of course.
So that's a whole nother topic for a whole different day, right? How to determine whether your issue is an emergency, to determine whether you need to do an ER visit, urgent care, or just see your doctor the next day or something. We need to be better about doing that as patients. But I also think that
self-assessment,
right? If you had a phone number to call where you can ask questions and they have access to your personal medical history, they know how to answer those questions. So again, that goes into choosing a good PCP,
a reputable PCP.
You'd be able to call your doctor and say, hey, I've been having chest pains. And that might mean nothing for someone who's perfectly healthy. But for someone who just had a triple bypass, that's a problem. And so
they will tell you call 911.
Right. And so that again goes back to having a good PCP, but also being in tune with your body and knowing what's an emergency to you. So let's just say you do end up in the ER and you're back to receive the care that you feel you need. Making sure that someone comes in and takes your chief complaint. So they take why you're coming in that day, right? Let's just say it's chest pains. I don't know why I'm focusing on chest
Hopefully
pains.
they will introduce themselves as well, because it could be the registrar rolling in.
It could be talk about your copay is $600, which my copay is $600 for the ER.
Oh my God!
I know. I said I will die on the side of the road before I pay.
But didn't mine go up too? Yeah, yes.
Yeah, it went up. It went up to like $250.
That's why I do urgent care.
Right. My copay now is between $600 and $700 is what the website says.
So they're trying to divert you to go to urgent care or go to your doctor.
Absolutely.
Okay.
And
it's working.
It makes sense. I mean, I still went because I felt like my life
was
at stake, and I'll pay $600 because at some point I'll pay it. But it's either that or die. Like, you know what I mean? And so if you feel like you are in an emergent situation where, let's just face it, some of these urgent cares are not set up to handle certain situations. Some of them are really good. They can do almost everything an ER can do.
You know the one that I go to.
Right.
They do everything but blood transfusions.
Right.
If you need that, you have to go.
Yeah.
But CAT scans, MRI, Dopplers.
Yeah. Some urgent cares do not do all of
Some
that.
of them don't even do x-rays.
Right. Some of them don't even give you fluids. So
maybe we can open up an urgent care.
I know. Now I'm thinking about it, because that would solve a lot of things. But you don't want to use urgent care as your primary care,
which a lot of people do.
Right. Goodness, a lot of different things are coming up during this episode where I'm like, oh, we need to talk about this. We need to talk about that.
Let me write down notes for future episodes.
Right. Let's just focus on this, because I'm like, using the ER as your PCP, and that's why the copay is $600 because they don't want you to do that.
Mm-hmm.
But
and you've been on the business side of that.
Right, on the business side, it's very expensive. So once you get into the ER, you know, like Kim said, hopefully they'll introduce themselves, they'll have good bedside manner. But to be honest, even pre-COVID, but post-COVID, it's only gotten worse, right? Doctors, PAs, nurses, they're all burnt out. You'd be lucky if you even see an actual doctor in the ER. You're most likely going to see a PA. That is really what they've been staffing ERs with lately. So you're going to see your nurse, right? Because they're going to handle doing your IV, your intake. You're going to see a registrar because they want that insurance information. And you're going to see some type of tech, depending on if you need tests run or, you know, what have you. And then most likely you're going to see a PA because they're not staffing these ERs with doctors because it's expensive to pay them. So advocating for yourself in the ER looks like, okay, making sure that the PA or doctor has at least introduced themselves to you, right? That if you need fluid or blood work done, that a nurse has come in to do that. And if you're able to, right, asking that those things are, that's like the bare minimum of things that need to be done, right? They take your chief complaint, they do whatever diagnostic tests. Yeah. Well, at this point, but yeah, diagnostic tests they need to do. So whether that's blood work, scans, so imaging, whether that's an MRI, a CT, a Doppler, an EKG, depending on your complaint, that they do any of those things. Mm-hmm. And then that someone comes in to discuss the results of those things with you.
So I don't want to stress that. That can all be time consuming because they can't do any of those things until the doctor puts in the order. The doctor can't put in the order until he comes to your bedside.
Yeah.
And then he can't discuss the results until he comes back in. And a lot of times that takes forever.
It does. And so that's why you have waiting, ER waiting rooms that are, people have died in them.
They died in the hall.
As best as they try to triage.
In the waiting room too. I've seen that on the news.
That's what I just said. They died in the waiting room. That's the first thing I said.
I just got here.
Yes, take a sip, girl. Died in the waiting room. So that's why we say also it's important how you get there. If you feel like you about to die, don't have your Ray in them take you. Call an ambulance, okay?
But the ambulance ride is so expensive.
It is
don't want to take an ambulance. And that's part of the problem too.
It is. I think this also just leads into make sure you're taking care of yourself before it gets to the point where you need to go to an ER.
Can I comment on that?
Yeah.
I'm going to piggyback off of Jasmine. You can either take good care of yourself before you get sick, or you can take good care of yourself because you are sick. Understand, those are two different things. If you are sick and you want to continue to live, then you are going to have to take care of yourself. Okay.
Mm-hmm. Yeah, so we have less of these emergent situations. But once you're in there, make sure you're seen by the doctor. Make sure any diagnostic tests are run. And then make sure someone interprets those results to you and you understand if you're being discharged, you're understanding your discharge instructions. Do not leave there until they've been explained to you and you fully understand them. That is something that I've seen and that we've both seen because Kim used to, I don't know if you still do this, but used to make calls to patients post-discharge.
Oh, yeah.
To make sure they understood their, it was mostly inpatient, but their discharge instructions. And a lot of times they did not understand.
They did not understand. A lot of them had medication that they could not afford to pick up. So instead of them reaching back out, or instead of the pharmacist reaching back out to the doctor saying, hey, this patient cannot afford this, can we give them something equivalent? Can you write a new order? They just wouldn't take it. So it was a lot of issues that patients had And no one knows, because once you get discharged, you're just lost.
Yeah, you get lost in the healthcare system.
Yeah, and it's hard to connect the dots after. It's very hard. And a lot of people have no one to teach them things, no one to advocate for them. Some of them can't advocate for themselves. Some people don't even know what their true diagnoses are. Like, you could ask somebody, do you have diabetes? During intake, there have been times that when I was a floor nurse and I'm asking a patient, oh, do you have hypertension? No. But then when they show me their meds, they're on metoprolol. And I'm like, why are you on this?
Yeah, so you want to make sure those things happen if you can, if you're well enough. And then when it comes to being a support person for a friend or a family member, right?
Which we do for a living.
Right. So I know for me, my mom is getting older now. And so I'm anytime she has to go to the hospital, whether it's like an ER situation or if she has a surgery or something, I go with her. And I make sure that I ask all the questions that, will be on our checklist. And I make sure that she is getting the care that she needs. And that could look different depending on what she's in the hospital for. Right. But I will tell you guys that in a hospital setting, if they notice that the patient has a family member that is advocating for them, they act differently. Okay. Mm-hmm. They make sure that they try to make sure that they have the medicine they need, depending on if it's a good hospital. They make sure that they are coming in and talking, just the way that they talk. I know that it's different, right? So you do want to make sure that even if the person is just there, that your family member has a support person, so that they know they have someone that cares about them, that will look for them if something happens. I do, unfortunately, you get treated differently if they know you have someone.
Can I piggyback off of that? Mm-hmm. So I do agree completely, but when I used to work on the floor, if we had like a VIP patient, mm-hmm. meaning it's a doctor's family member, somebody from the board, they would tell me during report, and I would always tell them, I don't care if this is a VIP patient, mm-hmm. because I treat all my patients the same way. So sometimes you have good nurses. I will say that I was one of those on the floor, where we gave everybody the best treatment ever. I always treated people as if they were my family. And it's because when my mom was in the hospital, I saw how it could be good or it could be bad for her stay. Mm-hmm. So I always tried to make sure that I was just the best to all my patients.
That's a really good point. But unfortunately, a lot of healthcare professionals are not as honest or valiant as you, right? And they do care if you are a VIP patient, and they're not nice. There have been healthcare professionals that kill people for whatever reason. I don't even know.
Yeah, that's true.
And that have gone into this business for all the wrong reasons, whether it is to make money or to have power or whatever it is.
Yeah.
But they've gone into it for the wrong reasons. And so the outcome of that is poor patient care. They have poor bedside manner. They're not compassionate. They're not considerate. They're dismissive.
They don't want to be there.
And a lot of people are those things. They dismiss your feelings. They dismiss your concerns. And so that's why a lot of the things that we're telling you to empower you will help you get through those people who are like that. Because everyone is not going to treat you like you're their grandmother or you're their sister or you're their family member. They hate their jobs. They're just there to get it over with. Mm-hmm. And unfortunately, when you come with that mindset, you are setting yourself up to miss a lot of things. You are not looking for what could be wrong with this patient.
You're not assessing properly.
You're not, and you don't really care. And so as a patient, you have to fill in that gap for those things that could be missed. Another experience that I've had recently is having my mom be in a nursing home. where she was getting rehab for her back. And then that experience was different in terms of advocating for her. I had to go as far as talking to the owner of the rehab and telling him, hey, I know some people in some places. I didn't know anybody in anywhere, but I know things, and this care is unacceptable. And if you don't fix it and get it together, I will take her out of there myself. Okay?
And we will be on 7 on your side,
right,
and help me out.
Exactly. That day, everyone flocked to her room. They fixed everything. The people on the floor said, I don't know what your daughter said to that man, but we're not messing with her. And so I don't feel like I should have had to do that, but I had to do it because, they left her sitting in her urine for hours. The food was inadequate. She was supposed to be being rehabbed. She was just sitting there. These are all things that cannot happen. If we want our healthcare system to work, we have to also work it. Unfortunately, we have to do it. I mean, that's with everything really in life. You gotta, put some effort into it as well. But everyone doesn't know all the ins and outs of it, and so you don't know the things to say to activate movement and change in people.
My first nursing job was in a nursing home, and honey, everything that you said is everything that it was. Horrible. If your family members are in a nursing home, I need you to elevate that advocating process, yes. Please, because never let the staff feel like this patient is alone.
Never. I feel like that's the number one setting where if they see the patient has no visitors coming regularly.
Yep.
They're gonna, because I don't even want to get into the deepness of that, but if your family member has to be in a nursing home for any period of time, you want to make sure that you create a support system. And like I said, we want to be able to do this in the future, be that support system, but you want to be able to create that support system, have that presence, even just the presence, even if you never say anything, just so that they know this person or this patient has at least one person that will cause a scene or will speak up or say something if we mistreat them, if we neglect them. I feel that neglect is a huge thing in these homes.
It is. It is.
They have the nursing to patient ratios are usually
Oh my God. I had like 50, 60 patients.
You have a lot of patients to one nurse.
On one nurse.
And it's very easy to forget about Mrs. Smith down the hall that is just there for memory care or whatever. I don't know.
You should also mention that you did research, because you did do research first.
I did.
And you want to look at the star ratings of these places. It should be on the Medicare website, right?
Yes, it is on the Medicare website.
On the CMS website.
So each nursing home or skilled nursing facility, because they're different, will have ratings, and they're broken out into different categories. So it'll rate them on their cleanliness, their quality, their rehab, if they have one. So not all nursing homes provide rehabilitative care.
Or hospice care.
Right, which means they have a physical therapist in-house where they either go to a physical therapy or occupational therapy gym to work out, or they have one come to their room where they have all the stuff that they need. But those ratings do mean something, because they have people that go out and observe how they're providing the care, the level of care, their infection rates, their bed sore rates, how many times their patients have to go to the ER from there.
And we know that from the business side.
Oh, gosh. So please, and also if your family member is in the hospital and they have to be sent to a skilled nursing facility or a rehab center, your some type of coordinator, they're called different things at different hospitals, should be presenting you with options, a list of options.
With a choice sheet.
Right. That says these are based on where you live, based on what you need. These are your options of nursing homes that your family member could choose from. And then you want to take the time. Don't rush through it. Don't just close your eyes and pick. Actually research these homes, not only on the CMS website, but also any other place
Yelp,
they have, right? Any other place they have reviews, right? You want to look into it to see what these homes are doing, like,
because those other reviews you will get the lowdown truth. Okay, and not only that, yes, look at that sheet. But if there's some place that Isabel's grandmother went and you heard good things about it,
yes, the word of mouth.
Yes, that's back to what she said earlier. Word of mouth.
Yeah,
research that place too.
Research that place and make sure that they accept the insurance. Well, the coordinator will do that. Should do that for you. But tell them, I don't see whatever the name of the home is on this sheet.
Beverly Hills Nursing Home.
Right. Right. I don't see the Ritz-Carlton Nursing Home on here. Please send the, I don't want to get too technical, but send over the PRI, which is a form for them to
see if they'll accept and if they have a bed available.
Yep, if they have a bed available, tell them to send it over there. And don't rush that process, because once they're in there, it's harder to get them switched to a different home.
You know that.
Whereas, yes, if you would have just had them at the good one in the first place. So don't rush that process. If you're being rushed to do that, tell whoever is rushing you, I need time to research. Now, don't take forever, but don't rush it either.
So they are going to try to rush you, right? Yeah. Because they want to hurry up and turn over that bed.
Yeah.
So they are going to try to rush you. But understand, they can't discharge Ernestine to nowhere. They have to discharge her to a nursing home. So you have to pick one. So they technically can't discharge.
They technically can't. And so that is a place to advocate for your loved one, right? Do your research. Do your best. We can't know everything. We just know what we know, right? Based off of what you research. But I beg of you, do not rush that decision. Do your best in trying to take all the information that you have into consideration, and choose the best place. But go with what you know would work best, not based on location, just the best care that they would receive, because it's their life.
Yeah. I just want to tell a little story. So my baby has to have her tonsils and adenoids taken out, right? So I took her to this reputable surgeon. She's had strep 6 times this year. So her tonsils have to come out. They're not working properly. Instead of her tonsils fighting off bacteria, it's bringing it in, and it's like welcome home. So she's had strep 6 times. Normally they do it at 7. Okay, I took her to this reputable surgeon after she had strep twice. And he was ready to book her for an OR. Me personally, I did my research. Evidence-based practice shows that if a child has had strep between 6 and 8 times in 1 year, they should probably come out. She had only had it twice. He was ready to book an OR. I got out of there, did research, took a recommendation from one of these doctors that both me and Jasmine know, did research on him. He's in network. He takes my insurance. Love him. She's still going to have her tonsils taken out, but she got strep 4 more times since then. If there's a doctor who is ready to cut you open and book an OR, and you just don't think that that's probably the best route to go, always go for a second opinion.
Yeah,
always.
Absolutely.
Don't let anybody just cut you open just because they said, unless it's something that you know for a fact. Unless you've needed like a hip or a knee transplant. I mean,
knee transplant knees now? I can't.
A hip or knee replacement. They don't do transplants. And you know for a fact that you needed one for years and it's bone on bone, then that's something different. But something like these tonsils, and I already did my research, run. Go the other way. We don't want these doctors who are fast to like.
Yeah, that also goes back to trusting your instincts and your gut, right? There was a recent news story about the doctor that had diagnosed
Oh my God! With
So many patients with cancer, just diagnosing. You get cancer. You get everybody was getting cancer. Everybody had cancer.
Didn't you send me that?
Yes.
Article? Yeah. Crazy.
Okay. Case in point.
They trusted
as
them.
to why you should do your own research. Ask for things to be explained to you thoroughly. Right? How did you determine I have cancer?
Reports. We need reports.
What was it through blood work? Was it through scans? Where is the cancer?
The biopsy?
Is it? Where does it spread to? Right? Let me see that report. And then also, if you don't feel like that, let me get a second opinion. Just like him said, I need a second opinion because while everyone that is a doctor has gone to medical school, they've gone through training, there's levels to this.
And not everyone has ethics.
Right. Not everyone has ethics and everyone is a good person. And so get a second opinion, especially with something like that. And I'm sure he was slicing and dicing folks after he made the diagnosis to say, oh, I just need to go in and remove the tumor, or I need to go in and do whatever. At the very least, he was saying you need chemo, which was in turn making people sick, right? The people that didn't even have the cancer, it was making them sick.
So my thing is this. I've personally had biopsies in my life. Once my results come in, the good old doctors that I've had have pushed my results through to the patient portal and they've called me. Mm-hmm. Where's the results from these biopsies? Are they not having biopsies? Were these people not educated enough to understand that, okay, yes, you have cancer, but we need to do a biopsy so we can stage it, so we can give you the grade? Like, right. I just want to know the details.
Well, that's what happens when you don't know what questions to ask, right? If you have been referred to an oncologist, then you need to ask the right questions, like about your diagnosis.
One of my family members had breast cancer, and her granddaughter, who's my cousin, she was going with her to go and see the breast surgeon, the gynecologist who sent her for the mammogram, the oncologist, like all of these doctors. I gave her a list of questions for each doctor because you can't ask the oncologist things that you should be asking the breast surgeon.
Yeah, it's different.
Yeah. All right.
Well, we hope that this helped empower you guys at least to know how to advocate for yourself in different settings, right? So questions to ask your PCP, how to go to the ER, what you should expect when you get there. Right, how you should get there. If you should even be going there, by the way, because you know the whole point is to get better, so you want to go to the right place to do that. Mm-hmm. ER versus urgent care. I feel like that could be a whole episode.
Girl, I wrote that down.
Okay.
That's also,
once you're inpatient, how to advocate for yourself or a family member or a loved one, and then if you have to go to some other setting post discharge, how to advocate for that as well. Once you're in there, it's similar, but you want to take your time in making that choice.
If you guys have any questions, you can always email us at healthcare snitches. No, not at healthcare snitches.
Yeah.
At healthcare snitches. I'm still learning. healthcaresnitches@gmail.com.
And we have an Instagram page as well as a TikTok page. It's Healthcare Snitches as well. So you can reach out to us, DM us through there, and send us topics through email. Yeah. If you want something to be covered. We also plan on going live on TikTok and IG certain times where you guys could pop in and ask us questions. Mm-hmm. And anything we can't answer, we can absolutely find the answer to
and get back to you,
because we have a lot of different connections with doctors
and
resources, things like that, where we could answer your questions at a later time if we can't answer them on the spot. So
hope you guys enjoyed this. Yes. Tune in next time for more snitching.